Employees who have routine exposure to BBPs, even part-time and temporary employees, must be offered the hepatitis B vaccine series at no cost to themselves unless they previously received the vaccine series. Antibody testing has revealed an immunity. The vaccine is contraindicated for some medical reasons, such as an allergy to yeast, which is in the vaccine. The vaccination process includes a series of 3 shots. The second shot is given 1 month after the first. The third shot follows 5 months after the second. This series must be offered at no cost to the employee during work hours and within 10 days of an assignment to a potential exposure to BBPs. Employees may opt to decline the vaccine, but they must complete a declination form. Employers must keep these forms on file so that they know the vaccination status of everyone who has a potential exposure to blood. The employee has the right to change their mind at any time and take the vaccine. HBV vaccine side effects are mild. The most common symptoms are bruising, redness, headache, localized swelling, and pain at the injection site. Severe side effects include allergic reactions. If this occurs, seek medical help. OSHA attempts to reduce the risk and exposure to BBPs to employees by instituting several strategies, including universal precautions, personal protective equipment, PPE, engineering controls, workplace practice controls, and administrative controls. Your employer is responsible for the cost of implementing these practices, and as the employee, you must conform to the policies. Universal precautions, as defined by the Center for Disease Control, are a set of precautions designed to prevent transmission of bloodborne pathogens. Under universal precautions, blood and other potentially infectious materials, OPIM, of all people are considered potentially infectious. Treat all potential body fluids as infected. If it's wet, don't touch it. OPIMs include any body fluid containing visible blood, semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, amniotic fluid, and infected cultures. PPE is used to provide a barrier between you and potential infections. Remember to protect yourself. A rescuer should always assume that blood and body fluids are infectious and don the appropriate equipment. The kit will contain aprons or jumpsuits, gloves, masks, and cleanup supplies, eye shields, caps, booties, and pocket masks when the possibility of exposure to blood or infectious materials exists. All PPE must be removed before leaving the work area.